And, the thing that I'm thinking about now more than ever before was that 5 years ago, I was really thinking, how do we introduce the concepts of remote virtual care to health systems so that they can really start to understand the benefit? And today it's, okay, now that the benefit is understood, how do we actually weave this into care on a daily basis in a way that really helps, and it helps clinicians drive better, more proactive care without being something else to do, right? Because we can't ask our frontline workers to do more. That's just not going to be something they can do. So, Tracy, with that, I'd love to start with you, kind of following on that. At Boston Medical Center, it's a safety net hospital. You rely, I think, a lot on state and federal grants for funding, and you serve a lot of immigrant, unhoused, and impoverished communities. I know we discussed before, and transportation access to care is at the center of your organization's innovation. And we now have the prospects of some of your patients perhaps dangerously delaying care due to fears of being picked up by the U.S. Immigration and Customs Enforcement. How is your organization just thinking about reaching your patients today when, they may have already been difficult to reach? How do you deliver more proactive healthcare in this current environment?
Yeah, thanks, Drew. It's a really good question. And it's true. Our patients have had lots of challenges in accessing care even before the current moment. So, right, we're grateful to have established some platforms to be able to reach them prior, and we'll be doubling down on those in the coming months, depending on how everything rolls out. But we have, we do a lot of different kinds of outreach to patients to connect them with care. We do a lot of old-fashioned phone calling, but we lead with multilingual care navigators who are skilled in motivational interviewing, trying to engage patients who have not felt ready to engage with the health system. And they start with acknowledging the barriers that those patients may have and not assuming that the person's that they have on the phone has their health at the top of mind. So trying to help them navigate some of the other barriers to getting care. We offer telehealth visits and a lot of remote patient monitoring, mostly administered by nurse practitioners and pharmacists. So getting to your point about the broader team engaging with those patients. And we've begun some pilots with texting to engage patients who are, many of whom, the vast majority of our patients have access to texting and prefer that to a telephone call if we can engage.